Hi, good afternoon, and welcome to our Teamsters Local 2010 Town Hall webinar, updates on the COVID-19 situation and how our union is fighting to protect our jobs and safety and income during this crisis. I'm Jason Rabinowitz. I'm Secretary Treasurer, Teamsters Local 2010. Glad to have everyone with us. We need to take a second and wait for everybody to get into the meeting here. We've already got over 130, and that number keeps going on up. So it looks like we're going to have good turnout, good attendance for this very, very important meeting. We thank everybody for being with us. We're going to get started in just a second. Okay. So it's 12:02. We've got 150 plus that are with us. Thanks to everybody for joining our very important meeting today. We've got Teamsters Local 2010 members from across the state on this webinar. We have a really packed agenda for you of really important information to give updates on COVID-19. We're very proud of the work that our 15,000 Teamsters across the CSU and UC systems have been doing, keeping California running through this crisis. Our members have been putting their, literally putting their lives and their safety on the line to keep the universities running. And our union has been working overtime to protect workers' safety, jobs, and income through this crisis. And so we're proud of the work that we're doing, but we also recognize that although we've got a vaccination, the crisis is still with us. And so we can't let up. We've got to keep on fighting to protect our members' rights, which is what we're doing. And this webinar is part of that. We've had a series of town hall webinars on COVID because knowledge is very important for protecting our rights. And so that's why we've been having these. Thanks to everyone who's been with us. Thanks to those who sent in questions. We're going to try to get to all the questions. Also, if you have a question while we're in the meeting, you can put it in the Q&A or in the chat. We're going to try to get to every question. If we don't, you can always reach out to your union rep or send us an email at the union's email, and we'll put all that in the chat for everybody as well. So today we're going to be just an overview of what we're doing. We have a legal update from one of our great attorneys at Beeson Taylor and Bodine, Lori Bradley. Then we're going to have an update on COVID-19 and vaccination issues from Lamont Bird, the Director of Safety and Health for the International Brotherhood of Teamsters. Then we're going to have a Local 2010 update on our fights against layoff and for paid leave and to protect our safety and livelihood during the crisis. And then we have an update from Alex Verme, our research analyst at Local 2010, on what's in the California budget and the stimulus for higher education. And then we'll do questions and answers. And so as you can see, it's jam-packed. Oh, and the Local 2010 update, we have myself, Jason Rabinowitz, we have Drew Scott, our Skilled Trades Director for Local 2010, and Tanya Kell, our Field Director for Local 2010. So with that, I'm going to move the agenda to our first speaker, a wonderful and great attorney at Beeson Taylor and Bodine, Lori Bradley. Lori, take it away.
All right. Good afternoon, everyone. I am going to go over the Cal OSHA requirements that apply due to COVID-19 and some of the features of the new COVID-19 emergency standard. Can everyone, can you hear me?
Yeah, we hear you. You sound great.
Okay. All right. Sorry. I saw something in the chat that said that I couldn't be heard. So the first thing that I want to go over is there's a new COVID-19 emergency standard that Cal OSHA has issued in response to the pandemic and the transmission that we know is occurring in workplaces. There are two standards that apply depending on where you work. So if you work in the healthcare system, I know we have a lot of people who work at a hospital but doing a more administrative function. But if you are working in patient care or exposed through patient care or laboratory work, there is a separate standard called the aerosol transmissible disease standard. And that applies in hospitals, clinics, labs, home health care, jails and prisons, shelters and drug treatment centers, just to name a few. And that's already been in place. So if you are subject to the aerosol transmissible disease standard, you probably know it, and you probably received training on respirators and things of that nature. But if you have questions about that, I would encourage you to reach out to your union rep or your organizer, and we have some resources on that standard that we can help you with. For everyone else, the people who are not working in direct patient care or not working in these specific workplaces, there's an emergency standard that's put in place in all of their workplaces in California in response to the COVID-19 pandemic. And it covers a lot. One of the things that it does is it requires every employer to have a prevention program. So to educate you on COVID-19, what it is, how you can get it, how you can protect yourself from it, and to know what the symptoms are, know what to do if you have the symptoms, if you think you've been exposed. And it also encourages people to report and prevents people from being retaliated against if they have a concern about COVID-19 or if they think that they've been exposed in the workplace. And it also has rules that the employers have to follow if there's an outbreak. So this is an outbreak that occurs in the workplace if there's more than 3 people in a specific workplace that have COVID-19. That means that there's probably some transmission that's going on at work, and so there's certain things that the employer needs to do in response to that. If there's an even larger outbreak that's called a major outbreak, then there's more that the employer has to do regarding ventilation. But the main thing that I want to leave you with regarding the outbreak provisions in the standard is that it requires testing. So the employer has to make testing available. And that can be either through letting you go get your own test on the work time. It can be through bringing testing into the workplace. But that testing has to be on work time and at no cost to you if there's an outbreak in your workplace. And one of the tricky things, especially for people who work on these large UC campuses, what is the workplace? Is the workplace all of UCLA, or is it all of UC Merced? And so the workplace can be limited to places where people only don't, it doesn't mean the entire campus. It'll mean the people that you have interchange with. And it also doesn't include something like if I just pass someone in the hall and we're both wearing masks, that would not be considered an exposure. But if I'm sharing an office with someone and we're working together throughout the day, then that would be a potential exposure. So the definition of what the workplace is going to depend on sort of how that personal interaction is happening at work. So it won't be the entire campus. It may not even be the entire building. It may just be a smaller section of the workplace where you do interact with your coworkers. And another important thing about the standard is that it requires exclusion. If someone is exposed to COVID-19 or if someone is what they call a COVID-19 case. A case means you've been diagnosed, your doctor or the health department says that you have it, usually through a positive test, but not necessarily required if the person can't be tested and the symptoms are clear. So you're a case if we know you have COVID-19, and you're an exposure if you've been exposed within 6 feet and for more than 15 minutes to someone who has it. So if you are a case or if you are exposed, there are different rules. There's sort of a protocol that you follow about how long you have to be exposed, how long you have to be excluded from the workplace. It's going to depend on when you were tested. If you tested positive, it's going to depend on when the exposure was and when your symptoms, if you have symptoms, when your symptoms go away without medication. So there's a sort of a numerical, you just basically count the days as far as how long you have to be excluded from the workplace and when you can come back. And it's important to know that the employer cannot require a negative test. Some of that's because of concerns that there may be some false negatives, but also because people who have COVID-19 and who recover and who are considered to no longer be able to transmit the disease may still test positive for we think up to 3 months now after having the disease. So the positive or negative test is not the main factor here in the exclusion from the workplace. It's really the exposure, when the exposure happened, when the symptoms or the positive test happened, and then counting the days after that. And if you have any questions about a specific situation, unfortunately, I'm not going to be able to take questions today because I have another commitment after this. But we have been working through with your business agent or with your union rep specific individual situations about when you should be excluded, when you can return to work, and what the employer can require in order for you to return to work. If you are excluded, if there's a way for you to do your job remotely, if you can do it at home, assuming that you are well enough to work, then that is an accommodation also that you can request. But if you are excluded and you can't work through no fault of your own, but this OSHA standard means that you have to stay home, you have to be excluded, then there is a provision for pay continuation. So that means that the employer has to maintain your pay, maintain your benefits while you're out of work because of the exposure or because of the sickness. And there are a few exceptions to that. One of the exceptions that's important to know is that if the employer can show that you got COVID-19 from someplace outside the workplace. So say I went on a 2-week vacation, I wasn't at work, I come back to work day one, then I'm back, and then I'm sick that evening. Then we could probably infer that I didn't get COVID-19 from the workplace. I probably got it, from home or from some social gathering or from going out somewhere. But sometimes too, working through those facts about, is the exposure work-related or is it not? And even someone who is not considered to have a work-related exposure and they may not be eligible for full pay continuation under the standard, there are other ways that people can keep that pay going while they're sick, including your disability plan, including unemployment. And so again, sometimes these can be really fact-specific issues. And so please contact your business agent or contact your union rep or organizer in your workplace, and we're happy to work through these situations, figure out what the proper exclusion period should be, when you can return to work, if you're eligible for pay continuation, and if you're not, what we can do to get some supplemental income coming in while you are not able to work. And then the final thing that I wanted to touch on is there's also a law that requires notification to employees and to the union if there are COVID cases in the workplace. So this is called AB 685. And it requires a notice to go out if if there's been an exposure. So the idea is we don't want the rumor mill to get started. We want, that's information that we need to protect ourselves and protect our coworkers. And so we really want that information to be accessible. Also for the union to be able to do its job, we really need to know what's going on. These notices don't require giving the person's name, but it does require, what location that they worked in. So, if someone said they were in the maintenance shop on second shift on Tuesday, then you could, know if you were a person who's also working there and figure out if there's been an exposure. And there have been some issues with compliance, so just to be honest with you all about it. There are sometimes departments and components of the university that don't want to be forthcoming with that information. Obviously, there's privacy concerns too for individuals and for our coworkers. And so we have to always balance that. But in some places, we've had trouble getting accurate and clear information about exposure in the workplace. And so if that's something that you are working with, I know we're advising the union and business agents about this. Please reach out if you have any questions. If you get a letter that says that there's been an exposure and you don't understand it, reach out and we're happy to help work through that. And also if you have concerns that there's an exposure that hasn't been shared or that the information's been restricted in a way that you feel like isn't enough to keep you safe, please let us know. And I think the final thing that we're looking at is, you know, if there are problems with compliance of this OSHA standard, if you feel like you are being exposed, if the work practices haven't been rearranged such that you can work comfortably and safely, if, you know, the mask requirements or the social distancing requirements aren't being fulfilled, if you're not getting enough information, then we are working with you know, how to respond to that, including through a complaint to Cal OSHA. And so this requires some, you know, we need some specifics about what actually you're facing in the workplace in your particular department and what's going on. But if that is information that you'd be willing to provide to help us put together a complaint, it'll go campus by campus based on where you work. Obviously, there are different situations in different parts of the state, and even from department to department or various areas on campus. But please reach out. Let us know if there are unsafe conditions. If it's something that you would be willing to have us include in an OSHA complaint, let us know that as well, and we will we're working on putting that together. So there should be, under this new standard, there should be information, education, training. There should be actual changes to practice to let you work safely. Things like barriers, social distancing, masks, availability of places to wash your hands. And then there should be this exclusion from the workplace of people who are exposed or people who are tested positive. But there's also a sort of transparent way that people can return to work after we know that according to the standard, the risk of transmission is low or no longer possible. So, you know, and if you are exposed, if you do test positive, number one, we wish you a full and complete recovery. But number two, please do reach out, and we can help work with these individual situations about how long you should be excluded, what your pay should be during exclusion, and when you can go back to work safely. So again, that hopefully gives you some information and guidance. We know that there's a lot of specific situations going on and specific issues. I'll see if I can do a little some responses in the chat. But if something comes up, if you still have questions, please reach out to whoever your local union contact is at your campus, and we'll do what we can to help you work through this. I know it can be a frightening time, especially with the surge in cases that we've gone through recently in some parts of the state. But we are working, and whether that's a complaint or whether that's working through the specifics of you know, return to work for your specific situation, we are doing what we can to help.
Okay, thank you, Lori, very much. And we especially appreciate that Lori has joined us when she's got a court appearance, I think, in just a few minutes. But there are some questions in the Q&A and in the chat, which, Lori, if you do have a minute, maybe to answer them on there before you go. And thanks again for being with us today. So our next speaker is from what has always been an important division in our or department in our international union, but has become perhaps one of the most important through this crisis, and that's our safety and health department. And Lamont Bird is the director of that department. They've been working round the clock, helping the 1.4 million Teamsters around the United States, Canada, and Puerto Rico to stay safe and healthy during this crisis. We're very pleased and fortunate to have Lamont with us to provide us an important update on the COVID virus. So I'm going to turn to you, Lamont. Thanks for being with us.
Okay, thank you, Jason. I'm going to share my screen. Okay, hopefully everyone can see my screen. So today I'm just going to give you a general update on what's going on with COVID. Everybody hear me okay? We're good? Okay. Give you a general overview of kind of what's going on with COVID and talk a little bit about vaccines and vaccinations. So we're going to talk about what we know, how we control the virus to lessen the impact, vaccines and vaccination, safety, side effects, and sources of information. So just to give you an update, as of yesterday, there were a little over 26.5 million COVID cases confirmed in the US, with a little over 3.5 million being in California. We had over 447,000 deaths, along with 39,000 of those deaths being in California. And overall, the number of positive cases is trending downward, which is a good sign, but we do have some concerns out on the horizon. I'll talk a little bit about that as we move through the presentation. So what do we know about COVID? We know that the range of illnesses range from mild symptoms to severe illness and death. We don't know how COVID is going to affect each person, but we do know that most likely older people and those individuals who have certain medical conditions are more likely to become severely ill, but or suffer a fatality. But one thing that makes COVID so interesting from a scientific perspective is that we know that it affects the older and the ill people, but there are young people who are seemingly healthy who have had very severe symptoms and who've also suffered death as a result of exposure to COVID-19. In terms of the incubation period, the time between exposure and developing symptoms typically ranges from 2 to 14 days, but an infected person may be contagious before symptoms develop. That would be pre-symptomatic, or if they're asymptomatic, they could be contagious and never develop any symptoms. So that's something to just to keep in mind. For us to get past this pandemic, we're going to have to use a combined approach. We're going to have to employ the basic CDC guidance on wearing a mask, physical distancing, avoiding touching your mouth, nose, and eyes with unwashed hands, having good ventilation in indoor spaces, cleaning and disinfecting frequently touched surfaces, using good hand hygiene. And the last component is that it's important that we get vaccinated. You probably heard quite a bit about the new variants of COVID-19 that have shown up, and there are lots of them, but the three prominent ones that we're concerned about are the ones from United Kingdom, that's B.1.1, and the concern is that could become the dominant strain here in the US. The South African strain is B.1.351. As of earlier this week, there have been some cases confirmed in the United States. I think Maryland and South Carolina is where they found some cases. And then the Brazilian strain is P1, which is mainly in Rio de Janeiro. But there has been cases discovered here in the US. And why these variants are important is because they appear to be more transmissible, so they're more contagious. And by being more contagious, it could result in more cases of COVID-19. It could result in more hospitalizations and deaths. We don't know how these mutations of the virus will respond to vaccines, but because they have a lot of the mutations are occurring on the protein spikes that I'll talk about that. You may be, if you see my slide, you could probably see these little spikes that are on the virus itself. It affects those protein spikes, and those spikes serve as a key for the virus to enter into the cell and infect it. And so we know that that'll probably have some impact on the efficacy of the vaccine. Let's talk a little bit about vaccines and vaccination. So the definition per the dictionary of a vaccine is that it is a biological preparation that provides active acquired immunity to a particular infectious disease. A vaccine typically contains a biological preparation from a disease-causing microorganism that either is extracted from the microorganism or synthetically produced in a laboratory. So how will the COVID vaccine protect you? So by getting a vaccine, by getting vaccinated, it will help your body to create an immune response should you be exposed to to the COVID-19 virus, SARS-CoV-2. Um, if you get COVID-19, by having been vaccinated, it may keep you from getting severely ill. And then by being vaccinated, you can protect your family, coworkers, and other people you may come into contact with. The benefits, there's several benefits to getting vaccinated for COVID-19. We think, well, we're certain that it'll decrease death and serious disease. It'll help us keep our supply chains open. It will allow our kids to go back to school and for us to go back to work. Instead of working virtually. It will reduce the number of infections. And by reducing the number of infections or cases, it will reduce the chance that the virus can further mutate. So we may be able to prevent worse or more dangerous variants from appearing if we can get this virus under control and reduce or pretty much eliminate the number of new cases that occur. And then it reduces the extra burden that the disease is having on people who are already facing disparities. So there are two vaccines that have currently received FDA approval under the emergency use authorization, and that's the Pfizer vaccine. It's a 2-dose vaccine that's given, the doses are given 21 days apart. And the Moderna vaccine, which is also a 2-dose vaccine that's given at least 28 days apart. So a question that's come across my desk quite a bit is what's in these vaccines? So there's messenger RNA of the spike protein that acts as a key for SARS-CoV to enter and infect our cells. So this was something that was created in a lab, and it's just a little piece of the RNA, the ribonucleic acid, that's on the virus that acts as a key to open the cells so that they can infect the cells. In addition, there is a lipid bubble, which is basically just a little fat bubble that protects the mRNA as it travels through your bloodstream and enters into your cells. There's a chemical, polyethylene glycol, that's a preservative. It's commonly found in various cosmetic products. And we think that this is the substance that might be causing the allergic reactions in a very few people. And then there are various salts and sugars. I think the take-home message is that there is no virus in this vaccine. So it is impossible for it to cause you to develop COVID-19 because the virus is not there. The only things there is the messenger RNA for the spike that allows the virus to get into your cell. So when you're vaccinated, what happens? Your body recognizes that a foreign substance, this spike protein, has been injected into your body. It creates an immune response that develops antibodies. It destroys the spike protein. It destroys that vaccine. If a vaccinated person is exposed to the virus later, your immune system will remember how to fight against that virus, and it'll provide you some protection. In terms of the effectiveness, both the Moderna and the Pfizer vaccines are in the mid-90s in terms of the efficacy rate. We think that the vaccines that have been approved will protect against the variants of the viruses, but it may be at a less effective rate, but it should still be good enough to offer significant protection. So we're optimistic that that'll be a good outcome there. COVID-19 vaccines are being held to the same safety standards as all other vaccines. And when we weigh the known benefits and the potential benefits to the potential and known risk, it by far favors the benefits, and that's why FDA provided this emergency use authorization. So a couple of other quick topics I'll cover is how quickly does the immunity occur? So you get your first dose, it primes your system, and some immunity starts 10 to 14 days after you get that first shot. Then you get your second shot. It further strengthens your immune response, provides a little more durability to the antibodies that have been created, and you get quote unquote full immunity 7 to 14 days after receiving the second shot. But it's important that immunity is not 100% at this time. We don't know how long the 95% immunity lasts, but there are estimates that it should last 2 to 3 years if we get annual booster shots, but we'll find out more as time passes. Side effects. So as is the case with most other adult vaccines, you're going to develop slight fever, some headache, possibly some muscle and body aches. The side effects are more common after the second dose of both of the vaccines. And these side effects are an indication of a good immune response. So it's not something to worry about. And for the more severe responses, there have been no deaths to date that have been attributed to, like anaphylactic shock or something like that. So, it's been a pretty safe vaccine. In terms of monitoring vaccine safety, the same systems that we use for all of our other vaccines are being used for the COVID-19 vaccines, and there are new systems being developed to collect additional data on adverse events by race and ethnicity. In terms of the number of doses administered nationwide, as of yesterday, there were 32.2 million doses administered, 3.5 million are in California. And this averages out to about 9.7 per 100 people across the country. In California, it's about 8.9 people have been vaccinated per 100, and that's at least getting one dose. But as compared, when you look at Israel and the United Kingdom, and they're doing a little better than the US, Israel leads the world at 57.6 doses per 100 people, and the UK is 14.4. As of yesterday, we're administering about 1.3 million doses per day in the US, and our goal is 1.5 million per day. The Advisory Committee on Immunization Practices advises CDC on the use of vaccines and the prioritization. And then when we look at the California vaccine priority list, you have 1A, 1B, and phase 1C. They're currently vaccinating in 1A and 1B. 1A are your long-term care residents, healthcare, and healthcare workers. Tier 2 of phase 1B is those who have occupational risk. This is, transportation, logistics, some industrial operations, congregate settings with outbreak risk, incarcerated individuals, and homeless shelters. They've yet to start tier 2, but I think that's coming pretty quickly. And then we'll transition in California to phase 3. And those are your population that's 50 to 64 years old, or people 16 years to 49 years who have medical conditions. And then there's others who have some occupational risks ranging from working in water and wastewater operations down to community-based essential function operations. You've probably heard the term herd immunity used, and this is a term that's used to describe the percentage of people that must be protected from the virus, either by having previously been infected by the virus, so they have antibodies, or through vaccination, so it's unlikely that a virus or bacteria can spread. For COVID-19, it's undetermined what we really need, what percentage we need to hit herd immunity, but I've heard Dr. Fauci mention 70 to 80% could be where the range. But what throws a wrench into the whole, ringer there is the fact that we have these variants. And there is at least some evidence that a person who's had COVID-19 could become reinfected by one of the new variants. There's another vaccine that is very close to approval. This is a Johnson & Johnson vaccine. It's not an mRNA virus vaccine. It's a modified adenovirus. It's only one dose that's needed. It's not as tough to, it's not as challenging to store. It can operate in standard refrigeration, and if approved, and Dr. Fauci this morning said he anticipated that it could be approved within the next week or two. They're estimating there could be 100 million doses available for use by the spring. Where can you get information? You can go to the IBT's website at teamster.org or teamstersafety.org. We've got a lot of good information on our website. You could go to Cal OSHA, your federal and state regulations. Of course, you can go to Centers for Disease Control and Prevention. And with that, I'd like to thank you for giving me some time to present, and I'll hang around for any questions that you might have. Thanks.
Thank you, Lamont, very much. Before we go to the next topic, there's a couple people who asked the same question, which maybe you can answer, Lamont, which is that if someone has already had COVID and is tested positive to the COVID virus, should they still get the vaccine or not?
That's a very good question, Jason. And the information that we've gotten on that particular issue is the answer would be yes. Even if you've had COVID, you should still get vaccinated. I actually have a family member who had COVID a couple of months ago, and she recently got her second dose of the Pfizer vaccine. So the answer would be yes. You should get vaccinated.
Okay, and another question was someone asks that if they're allergic to some cosmetic products, should they still get the vaccination? Any way to double check an allergic reaction to this vaccine?
The information that we've gotten on that, Jason, is that the answer would be yes. But if you have allergies, even if you've had severe allergic reactions, it's very important that you tell the doctor or the healthcare professional who's providing the vaccine prior to you getting the shot, because if you use an EpiPen, for example, they would want to know that going in prior to administering the vaccine. I had an opportunity to talk with a physician, infectious disease physician from Duke University about this very issue, and this is what he conveyed to me, that just be sure to notify the person who's going to administer the vaccine, and they'll deal with this on a case-by-case basis. But more than likely, you'll get the vaccine anyway. They'll just watch you after they administer it.
All right. Well, I want to thank Lamont for being with us, and I think Lamont's going to stick around because we will have other questions. Here's one from Stephanie. Is the COVID vaccine different from the flu shot? If you've had one, should you get the other?
I'm sorry.
Is the COVID vaccine different from the flu shot? So if you had the flu shot, should you still get the COVID shot?
Yes, you should. You should get the COVID vaccine, even if you've gotten your seasonal influenza shot. But there will be an interval between, like you couldn't get both on the same day. You know, they're advising that there be at least an interval. The last numbers I heard was at least a 2-week interval between the seasonal vaccine and the seasonal flu vaccine and the COVID-19 vaccine.
All right. Thanks very much, Lamont. Okay, now we're going to move the agenda to our local 2010 update, and there's a lot to talk about. Since this virus hit back in March of last year or thereabouts, our union jumped into action to make sure that our members' safety was protected and our jobs and income through the crisis. And you know, we were meeting with both university leaderships pretty much every day at the beginning, dealing with every manner of safety issue, and then also demanding that there be no layoffs, no loss in income. We were at the Regents meeting. We were meeting with the university every day. We were meeting with the legislature and making sure that we protected our members' income. And we're very proud of the fact that we have been very successful in Local 2010, that through the last fiscal year, we kept every member on payroll. We won paid leave for COVID-related reasons. We won no layoff guarantees. And then into the fall of last year, when there were big budget cuts came down, we held off any kind of statewide layoff curtailments. They wanted to do, they wanted us to give up our pay increases in the contract. We held the line on that. They wanted us to, they were talking about statewide layoffs. We stopped that. There have been some layoff notices here and there. We've been fighting every single one of them tooth and nail and have managed to get the majority of the notices thrown out. And we're continuing the fight because the old leave programs expired at the end of last year. So we've been pushing the universities to renew them. And Drew and Tanya will be reporting on some of our victories in that regard. And so we're just continuing the fight. You know, there's a lot of discussion about the vaccinations, and we thank Lamont for sharing some of the basic science with us. We also recognize that our members have different points of view on vaccinations. You know, everybody's entitled to their point of view and everyone's entitled to their rights. When it came to the flu vaccine, the University of California made it mandatory for everybody for the first time ever. That was a big change, and we said we want to bargain that. We want to. We demanded a personal exemption for those that wanted it. We demanded that those that wanted the vaccine should get it on paid time and for free. We won those things. On the personal exemption, we bargained, we sued, we went all out on it. We didn't get the personal exemption, but what we got was that the religious exemption was applied very broadly, and so most people that did want to opt out were able to. We're trying to stand up for all of our members in this situation. When it comes to the COVID-19 vaccination, obviously that's a different deal. COVID is a very different disease than the seasonal flu and has caused all kinds of havoc in our society, 400,000 plus deaths. So we've been working with the university, with both universities to make sure that our members have access to the vaccination as quickly as possible in accordance with the regulations that have come down. At the same time, the university, the questions have come through in the chat. The University of California and CSU have not made the COVID vaccine mandatory for employees as of now. And that's something that may change in the future. Some other employers have made it mandatory. As of now, it's optional. You know, we are fighting for our members to have access to the vaccine. We consider that to be very important, especially for our frontline workers, our health and our healthcare members, and so on. So we've been fighting on that. In Local 2010, you know, as long as there's this COVID crisis is with us, we're going to be fighting day and night to protect our safety, protect our jobs and income. I'm going to turn the floor to Drew Scott now, who's going to talk about what we've accomplished with the CSU in terms of the COVID hours and some other wins. And then we're going to hear from Tanya Akel. So Drew's our Skilled Trades Director. And so I'm going to turn to you, Drew. Thanks for being with us.
Thank you, Jason. I just want to remind everybody that what I'm about to talk about pertains to the CSU and not this UC yet. We're trying to use this information to push the UC, but we had a emergency pay grievance that we had filed over emergency pay because our contract has it in it. It has some pretty strict parameters to it that weren't fully met. But we had filed the grievance anyhow, and CSU knew that there was a problem with the meet and confer obligation as a part of it, but nobody thought that we could get emergency pay for 8 months for people that have worked through it. And so what we've done is we've wound up negotiating with the CSU to get 256 hours of expanded COVID relief time that people can use, kind of similar to what was under the CPAL, but this time it's different. Management can't cause you to use it if they don't want you at the campus. This is strictly for you to use as you need. It's for your own COVID-19 illness or the employee experiencing COVID-19 related symptoms and is seeking diagnosis for their own illness, care for the employee's immediate family member who resides in the employee's household, who has COVID-19 symptoms or illness. The employee is responsible for the care of a minor child who resides in the employee's household and whose school or daycare is closed due to the COVID-19, resulting in employee being unable to work. The employee is excluded from the work site because of a requirement under Cal OSHA General Industry Safety Order, Section 3205. In this, we have this 256 hours that we negotiated along with this. There's also an enhancement to the Cal OSHA workplace exclusion requirement. Under the original requirement, even if you got COVID-19 or were exposed to COVID-19 at the workplace, they could still make you use your sick leave time. And then after that, they could offer telework if you were able to work, and if not, then they would have to give you exclusion pay. The enhancement that we got to that with the CSU is that if you got your COVID-19 exposure on the job site or at the job, now you will go immediately on exclusion pay. It won't use your 256 and it'll never touch your sick pay. So we just kind of wanted to go over that. And then as far as the layoffs that we did have in CSU, we were noticed on 29 layoffs at 6 different campuses. And so far in that fight, we've gotten down to 13 and a half is where we're at. We actually have one person with a reduced time schedule rather than a full layoff. And that would conclude my report.
All right, thank you, Drew. Now I'm going to turn it to Tanya Kell, our field director for Local 2010. Tanya.
Hi, everybody. So our fight continues, as Jason and Drew talked about. We've been continuously fighting to protect people's jobs, make sure that we had limited furloughs. At the UC side, the Office of the President proposed a curtailment program and furlough program, and it did not make it mandatory system-wide. In the end, the only location to date that has decided to try and furlough, meaning make people take unpaid days off this fiscal year, is Office of the President. And it's ridiculous because the people that they want to take unpaid days off are those working in our call centers that all of us rely on to get paid, to retire, and they're backed up. So it's a nonsensical proposal, and we continue to fight on that and not accept it, and we'll continue to do what we've been doing. We had a few layoffs, some unfair ones, especially unfair and egregious ones in UC San Diego Health, and we've worked with student coalitions. We've done petitions, we've done social media stories, we've did call-in days to the leadership there. We've written every single doctor at UC San Diego, and of course we're taking legal actions through the form of grievances. And so again, that continues. We're fighting tooth and nail every time someone has been laid off. I just want to make that clear. And we're going to continue that fight at UC Berkeley. Is the latest battleground where they have postponed making a decision about more furloughs and layoffs. And so the fight will continue to protect members' jobs. I think with time, we're doing better. You're going to hear from Alex, the budgetary situation is not as dire. And so the reasoning behind needing to do layoffs dissipates. So we'll continue those fights. Our new fights are why, it's kind of interesting that why doesn't UC just follow the law and the Cal OSHA regs and the ATB standard? And they don't. It's a constant fight that when you contact us, we're bringing it up at every level. And so for right now, you heard our attorney, Lori Bradley, talk about the Cal OSHA standard. You heard how at Cal State, they're abiding by that and they've actually enhanced it. If you get exposed to work and you have to isolate at home, at the Cal State, they're not going to make you use your sick time. At the UC, not only are they making you use your sick time, when you run out of sick time, they're saying, we're going to make you use your vacation time or go unpaid, which is in violation of state Cal OSHA standards. So again, we're preparing legal action on that. And it's, ridiculous things that we have to continually fight on. We're going to fight for the same extension of hours. People really need, who used up their 128 hours last year, we really need them again this year. This has lasted longer than it's supposed to in everybody's minds and plans and thoughts. And our kids still aren't at school. So the federal program for FFCRA, we're fighting to make sure that that gets extended to this fiscal year. To date, UC and Cal State has not agreed to that. We're fighting at the federal level to make it mandatory, so it's not a choice for these employers, because they can't extend it. I think at least one location has, which is UC Davis Health System for the FFCRA, which is, or the EPSL, when you had kids that you were caring for from school. The other thing that we're working on right now, and have from the very beginning, was trying to make sure people were able to work from home. Now it never stops. Some employers are saying, well, now we want you to come back to university. We're going to need you, or we're going to need you next fiscal year when the more students come back. So we're going to be, if you don't really need to be at the office, and there's nothing in our contracts, don't believe the lies, that says you can't continue to work from home. So we will take up those fights as well, and we'll continue to fight on folks' behalfs in those areas. I know people had those questions. And that's it for now. If there's other questions, we can try and get to them. I wanted to make sure you got a budget update from Alex in the time we had.
Okay. Thanks very much, Tanya and Drew. So we're doing our best to address all the questions. If your question didn't get answered, you can follow up with your union representative. Amy is going to post in the chat. She did already, but why don't we post it again, the link in our website to find out your rep. And let's also post the email address that people, the general mailbox that people can write to with questions, and we'll make sure that we get back. And also I want to make sure we note that today and through February, Teamsters Local 2010 honors Black History Month. We hope that you saw the message that came from myself and President Catherine Cobb to the membership. And so we want to recognize that, and thanks to Rocio Richards, who put together this great background for the Zoom for us. Now I'm going to turn it to Alex Verme. Alex is our brilliant research analyst in Local 2010, who's going to give us an update on what was in the budget, the California budget, which, you know, we fought and turned out to be better than expected, and then also what's in the stimulus for UC and CSU, because that's going to affect the resources available for our members when we go fighting for protecting our jobs and income. So Alex, take it away.
All right, great. So, hey everybody. So I'll keep this brief in the interest of time. I'm going to give kind of a high-level view of what's in the stimulus, the stimulus that was passed in December, and then also what was in the governor's January budget proposal. So looking at the stimulus first, on the UC side, UC is going to be receiving in total more than $390 million. This is a significant amount of money, and that it's actually over $100 million more than they received under the earlier CARES Act stimulus from earlier in last year. And they have to use a certain portion of this for student financial aid, but that still leaves a total of over $260 million that can be used for addressing COVID-19 impacts, financial losses, various things, and really preventing layoffs is what, of course, we're going to be pushing, and any furloughs, any other austerity is what we're going to be pushing them to do with that money. On the CSU side, they're in line for a total of more than $850 million, which is an increase of more than $300 million from what they got in the earlier CARES Act stimulus. So pretty substantial. When you subtract out the amount of money that has to go to students for financial aid and emergency grants, that's still more than $590 million that can be used to address COVID-19 impacts, financial losses, and of course, prevent layoffs and other austerity. Just to note that so I'm giving the overall numbers, but it's parceled out by campus, and depending upon the size of the campus, the number of undergraduate students, the number of underrepresented students, the numbers vary by campus. But I just wanted to give the overall summary, so I'm not having to go through like more than 30 campuses, giving all the numbers for that. But so that's from this round of stimulus. There are discussions in Washington for another round of stimulus that you might be seeing in the news. We'll see where that goes. There's movement towards additional funding for higher education and for state and local governments. That would all be very significant as well. But turning to the January budget proposal, so the governor proposed in that budget an increase for both CSU and UC that's equivalent to a 3% increase in their base level state funding. It's important to note that while this is an increase over this current budget year, it still doesn't fully make up the cut that they took for this year, but it's still a step in the right direction, and everybody's going to be continuing to push the state to restore the funding. But on top of this kind of base 3% in the proposal, there's also other millions in one-time funding and other funds, including significantly $175 million for deferred maintenance for both UC and CSU, which is obviously of interest to our skilled trades members. Another caveat for this is that, so this is the January proposal. The budget's going to go through multiple revisions from the legislature and others throughout this process before being finalized in June. But this is still a positive sign that the state's budget situation isn't as dire as it was going to expect it to be. And, so these two developments together, we're really pointing to with both systems to tell them, you didn't have justification before for this austerity, for these layoffs, for any furloughs, any of these kinds of things, but it's even more apparent now. So we're really pushing them to rescind any remaining layoffs, pull back on any plans for furloughs or unpaid curtailments, and just stop this austerity and stop these cuts, because this is all money on top of the billions they already have in reserves, and they need to be treating our members, treating their workers with respect and for the work they're doing during this pandemic. So that's my very quick summary, since I see we're at 1.
That was good. That was and right on time. It's 1 p.m., so we're coming to the end of our presentation. We had over 250 people on this meeting. Thanks to all our panelists. I want to just say a couple things, because a couple people asked about working from home. And we were successful in winning the right for thousands of our members to work from home safely during this crisis. And a lot of people are asking, well, if it works so well, what's the rush to go back to work, especially since COVID is still with us? And campus by campus, we've been working with our members to try to fight for our members to continue to work from home safely, as long as it can be done productively, successfully, which it can in most cases. And so if you're having an issue, if you're being ordered back to on-site work and you think it's too soon, contact your union rep. The contact information is, we put it in the chat. You can always come look at our website, teamsters2010.org, for all that information. And also to Alex's point on the stimulus, soon we hope to have a new stimulus bill introduced in Congress, which will have some real stimulus for public sector. And so Teamsters are going to be called upon to call our members of Congress. And so you'll be hearing from us because we're going to want to push this thing and make sure that the stimulus gets passed. It has assistance for working people. It has stimulus for public sector and a lot of other important things to keep our economy going and protect working people through the COVID crisis. So more on that to come. Anyways, we are coming to the end of our hour. If your question didn't get answered, please call your union rep or send in the question to the Teamsters at our general mailbox, which we put in the chat. We want to thank all our speakers and most of all, thank all of our members for being with us and for all the hard work that you're doing to keep University of California, CSU, and the state of California running through this crisis. We appreciate you, we honor you, and we're fighting for all working people's rights during this difficult time. Thanks for being with us. Stay safe, stay healthy, stay united, and stay Teamster strong. Thanks very much. That'll do it.